Siaya County, through the Department of Health, welcomes all stakeholders to this year's World AIDS Day commemoration. This year's celebration is premised on the following objectives: to ensure essential HIV services are maintained in the community with the help of everybody plus the Nyamrerwas, to reach out to key and vulnerable populations and assist them to access HIV services when they need them, to ensure that adolescents, youth at risk, pregnant women and infants receive adequate care that incorporates HIV treatment, combat stigma and discrimination, to ensure that everyone feels safe to access HIV services, support health workers to provide HIV services to everyone in the community. These are the premised items for this celebration. And who helps us? Siaya County, through the Department of Health, has a total number of 274 facilities, of which 174 are public facilities. The rest are private. Those are the ones which help us fight HIV/AIDS. The facilities offering specifically HIV care and treatment sites are 146 out of the number that I've mentioned. And who supports us there? The international ones. Center for Health Solutions supports 81 of the 146 care and treatment sites and 4 drop-in centers. I think tunaweza kuwapatia makofi. Then there is Siaya County Health Management Team, COACT, who support 49 of those facilities. That one is driven mainly by Siaya County. And then there is KCCB, Kenya Council of Catholic Bishops, acts. They support 11 care and treatment sites. I think we also need to thank them, and you clap for them, please. And the LVCT GK prison, they have 1 center. Now you know where all these centers are, and the services that are offered under HIV program are the HIV testing services, the pre-exposure prophylaxis, the post-exposure prophylaxis. They provide antiretroviral therapy. They do voluntary male medical circumcision. And our chief guest, I want to tell you that this is a success in our community, because our community was not very welcoming to circumcision. But you will hear that the numbers have really increased. We are doing very well. The PMTCT, prevention of mother-to-child transmission. The other services provided by the facilities include gender-based violence issues, guidance, support, the key and vulnerable population, all issues pertaining to the vulnerable group. I think in this group you include the fishermen and all these vendors, the OVC, orphans and vulnerable population, through a number of the partners that were mentioned here. But more specifically, you say it for the child, the green zone agencies, they were exhibiting here. Their representatives talk to you. And then there is the community integrated services through a good number of community-based partners, the CMMD, Mild May, UCA, HAEC, Globecom, who are all exhibiting here. I want to say that by focusing on these key responsibilities, all these partners and whatever the department is doing, we are contributing significantly to the overall goal of reducing HIV transmission, improving access to care, and creating a supportive community environment for individuals affected by AIDS. Collaboration with healthcare professionals, local organizations, and community members is very essential for us to achieve our goal. Last but not least, the Department of Health appreciates the immense support from all the various HIV and sexual reproductive health implementing partners, both at the facility and the community level. Before I hand over to our chief guest, I just want to plead that, especially for the community, and remembering our theme, over and above fighting HIV/AIDS, I want to take this opportunity to ask all members to ensure, to make effort to get health insurance. Previously, we have been having NHIF. Currently, we have social health insurance. And as you know, the focus of our national government is to go back to public health preventive care and to involve community health promoters and everybody in the community. You will play your part very much if you take time and get some health insurance. As I have said, the government is in support, and we all know the acts that have been passed in bills and the efforts being made to make the payment for these health insurances manageable. I really plead that you take this very seriously, because every day that I have been in the office for 1 year, rarely a week passes without 2 people being stranded in one of our hospitals because they are not able to pay for their health bills. On that note, thank you very much. Nyamurerwa oye. I was privileged last year to attend the World AIDS Day, which was held in Bondo on 1st December 2022. I was pretty new in office. I was just 3 days as Waziri. And if I compare what I saw that day, the attendance, and what is here, I think for those who are with me there, Ugunja sub-county has more or less matched what was there last year. Is that correct? I saw faces here who are with me there. They should really acknowledge and support me. I want to thank Ugunja sub-county, especially the community, for this good big attendance. And at the same time, I want to apologize that we were a bit late. There were so many things to do, and it was circumstances beyond our control. The theme for this year, World AIDS Day commemoration, is let the communities lead. And that makes me start by praising Nyamurerwas, the community health promoters, and of course, the community as a whole. My part will just be to point out the role of our partners, because without those partners, we would not be where we are.
Kwa timba kali za Afrika, DURB Radio ndio mpango mzima.